You know what, we've been very efficient in our time, and there were a couple of people who did want to ask a question. So if there's no objection to the candidates, maybe we can have a question, a healthcare question actually, from Sandy Ellis, and we'll go from Mr. Robinson on back to Representative Conroy in the order.
Hi everyone.
Sandy.
I'd like to hear your ideas about how you'll address the healthcare crisis in our country.
Mr. Robinson.
Before I talk about healthcare, I want to say that the first thing we have to do is fix the economy. I have to stay focused on that. You know, I have to be honest about that. If we try to fix healthcare, the first thing in Congress again, it'll be trouble. I think a lot of people outside the Democratic Party are already pretty frustrated by the process. That said, I believe in what's called community-based health care, or which would be like the original Harvard Community Health Plan. The idea is that some group of people gets together, or a business gets together or something, and they're in the business of providing health care. They collect money from the patients, they provide basic care with that, and they turn around and they buy insurance for catastrophic illness only. What that does is it moves the cash flow so that the insurance companies aren't getting a 30% markup on the entire healthcare budget. It's not a new idea, it's not my idea. I mean, it's Harvard Community Health Plan is a good example of that. Massachusetts incidentally outlawed real community-based healthcare when they, the first time they reformed healthcare. You know, I was working as a contractor then and buying my own health insurance, and mine went up about 40% because of that little mistake. Now, single-payer health care is a form of community-based health care. I don't believe single-payer health care, at least in terms of expanding Medicare to cover everybody, is a viable thing. There's virtually no chance of getting it passed, so we're kind of wasting our time to even talk about it. But also, I don't think people have thought through what's going to happen with doing something like expanding Medicare to cover everybody. What's going to happen with reproductive health care? And I think that pretty much covers where I stand on it. I also think that making a huge change that just jumps in on everybody can't fly, because people really get upset when you start changing their health care. Even if you're making it better, they still get upset. So we need to come up with some kind of a scheme that we move to gradually as we fix it. And I do actually have something on my website that talks about that a little bit more, herbrobinson.us.
Thanks. Sandy, if you don't mind, can I just kind of redirect the question about health care? The Obama health care plan is under attack. And I think a more specific question would be, you know, what do you think about the Obama health care plan, and what, if anything, do you think should change about it?
Health care is a right, not a privilege in this country. I believe very strongly in that. But we do need to defend and improve this bill. It is under attack. Scott Brown ran as the guy that was going to repeal health care. He continues to say this. First and foremost, we have to make sure it's affordable. It doesn't bankrupt families, municipalities, and individuals. I think there are sensible ways to bring down the cost of health care. In the Medicare program, for example, we should allow the Medicare program to negotiate for drug prices. It doesn't have the capacity to do that right now. The Medicaid program can do it. If you did it in the Medicare program, you could save close to $200 billion. Substantial savings. I believe the Medicare program should have the capacity to import drugs outside the United States. Places like Canada. Substantial savings, close to $19 billion. Should have been in the bill last year. And finally, I believe we should move towards a system that promotes patient outcomes and not the number of procedures. There's a panel inside that healthcare bill right now that Scott Brown's trying to repeal that moves the healthcare system towards that end, and it could reduce costs by 30%. None of these proposals actually cut back on the benefits that are provided in the Medicare program. We don't have to cut people's benefits, and we don't have to privatize Medicare to make it more affordable. So that's where I would concentrate my efforts.
Great. Thank you, Mayor. Mr. Franco.
Thanks. I support single-payer health care. And what's wrong with the current health care is, thank you, is that when you're a leader, you don't negotiate from the middle. And as the actual only practicing attorney in this race with 15 years of litigation and negotiation experience, a little tip to Congress is you start high to end up where you want to be. You don't start at the middle to end up at the bare minimum. And what they should have done was put single payer on the table, and they would have ended up with public option instead of public option and ending up with not. Mandates is a Republican idea. And all it does is give the insurance companies 35 million new customers to pad their salaries. The writing is on the wall. We keep tinkering with these different ideas, patient outcomes, patient and we're going to cut costs and hospital stay limits and everything. My dad is a doctor and my mom is a nurse. They're both retired, but my dad was internal medicine specialist. And there is no way he could ever practice medicine today because he would actually take the time, half an hour, 45 minutes, an hour, with a patient, diagnosing their very serious illnesses and literally saving their lives. We do not get that kind of healthcare today. I know no one does. I know, my general practitioner is pretty good, but if anyone's been to the gynecologist, you could time them on a stopwatch, 3 minutes or less. So single payer is the way that we have to go because I'm telling it like it is, okay? And we spend $7,000 to $8,000 per capita in this country. The closest competitors to us in the industrialized world, Canada, France, and Britain, $4,000 and less. Okay, we are not getting what we paid for. We must go to single payer because it is the fairest and most equal. And you know who's upset about their health care? If we want to change their health care? The 45 million people in this country that don't have any. So how do we save costs? Because 30% of every single dollar in healthcare goes to administrative costs. And that is the insurance companies. And I will tell you the fights that my mother had because she managed the office. They will keep the doctor's money as long as possible until they feel like paying you. That is why single payer must be the way. Today we start the fight. We don't see how this healthcare works. We start the fight today because we want to get there tomorrow.